my name is Dr. Hunt, and today I will be discussing with you guys dissociative identity disorder. It is more commonly known as DID, or multiple personality disorder. It is a mental illness and a dissociative disorder. It is a disorder where a person has two or more personality or identity states, and they can take control of a person at any certain time, and the personalities are very different. Please welcome our guest, Emily. Hey, so thank you for joining us today.
Yes, thank
now,
you
would
for
you tell us
me.
the history behind DID?
The history of identity disorder is it was first thought to be discovered through Paleolithic cave paintings. The first real case was discovered by Samuel Mitchell.
What are the main causes of DID?
The main causes of DID are commonly severe childhood trauma, emotional, physical, or sexual abuse. Stress is also another cause, and the person usually doesn't feel safe, so they will develop a second personality as a coping method. And now I brought one of my patients, Michael Jackson. This is Michael Jackson. He brought his therapist with him. So now we're going to ask you guys some questions about DID. So we are back here with Michael Jackson. How are you today?
I am good. I'm so happy. I'm just thankful for everyone, like my therapist and just all the people that helped me through this.
Okay. As I recall from reading, DID is caused by severe childhood trauma. What happened in your childhood?
It's not me. No, not me.
What's not you?
Oh, I don't know.
This is what happens when you have DID. Oh, can we go? Okay, so you're with a lot of patients with the DID. How do you describe some of the symptoms of your patients?
Large memory losses that are more complex than forgetfulness. The person can't remember large parts of their childhood, not knowing/remembering how you got to certain places. Flashbacks or scarring events, hallucinating, attempts of suicide, and changes in handwriting are all recognized.
Are there ways to prevent those symptoms of your DID patients?
Yeah, if a child is having a stressful childhood, you could seek help. Talk to a doctor immediately after your child has had a traumatization. Your doctor can find mental health doctor that will help cope with the problems.
Sweet, thank you.
Yeah.
Why did I go over here? What's happening? Oh, jeez. It wasn't me. Oh, no.
Okay, so since you have DID, what are some of the treatments that you are going through or have done?
Well, I'm in the process of a treatment right now, and it can last 5 to 7 years for adults, and yes, I am an adult. Psychotherapy is an option where the worker works with the patient or triggering the causes of DID and tries to stop them from happening by talking about the trauma they've experienced in their life. That is my psychotherapist right over there.
Are you on any medications?
There is no known medications to treat DID, but antidepressants may help.
So how is working with Michael Jackson through treatment?
It's utterly terrible, and most days I want to commit suicide, but I help him through the day and with his life, and he's getting better.
What do you do exactly?
Well, we go past the events that traumatized him and sort of analyze them and really help to see like what happened there and what he thinks happened there. Sometimes I like to yell childhood just to have fun. Childhood!
We'd like to say thanks to our guest speakers, but because of what you just witnessed, Michael Jackson and his psychotherapist had to leave. We're going to cover risk factors.
The risk factors include childhood abuse or trauma, such as sexual abuse or physical abuse, experiencing traumatic life events like really big storms or war, and another part of it is just heredity.
Some of the interesting facts are:
There is 13 to 15 different personalities people can have with DID.
DID is not easy to recognize. Most people with DID spend about 7 years in a mental health system before a doctor actually diagnoses them.
Dissociative identity disorder is the most extreme kind of dissociative disorder. There's no for sure cure for DID.
people with DID are normally very intelligent and very creative. To conclude today's show, we like to recap what happened. DID, or multiple personality disorder, is a mental illness and a dissociative disorder where a person can have two or more identity states that can take control of a person at different times and make the person act very differently. Although treatment is a very long process and can take up to 5 to 7 years, it is very treatable. Now I want to thank Emily for coming. Thank you so much.
You're welcome.